Good morning, Dr. Gary on the road, Dental Practices for Sale. The name of our company is Healthcarepracticesales. We've been in business now 11 years. And our phone number is 201-663-0935. Our website is dentalpracticeguide.com. All this information is for entertainment purposes. Speak to your attorney or your accountant for business and legal information. So, one of the questions that comes up often, and I guess the title of this would be, when selling a dental practice, what happens with very highly paid staff? Often we have a situation where some of the staff members have been on 20 or 25 years and their salary has accelerated. And they're worth it. Yes, indeed, they're worth it. They work to build your practice. The value is the communication with the patients. It is highly worth it. And we strongly suggest all buyers continue on with the same staff. That is the link to the past. However, there are times that a buyer is afraid to move forward. We do the best we can to convince them. But they're just afraid to move forward because the staff salaries have been so inflated after 25 years, the buyer feels with his overhead, it's really going to affect him. And sometimes we lose a deal because of that. So you have a situation that the seller has a long-term dedicated staff. There's a link to the past, and I feel that they're worth it to keep them on. But again, you run into the situation where your staff salaries are so high, the private buyer, even the DSO, is sometimes afraid to move forward. And they don't want to fire a staff member because they feel it'll lose too much. What do you do? Well, in those circumstances, perhaps if that 2 years ahead of time, it may not be a bad idea if you can get another qualified younger staff member that has the same skill set and communicate as well with the patients, but a somewhat lower salary, and you have a salaried individual or a highly hourly paid individual that's dedicated and has been thinking about retirement. Maybe you should make a settlement with them and pay them a fair, fee, whatever, because they spent a good part of their life helping you build your practice. But maybe what you should do in those circumstances is begin lowering your staff costs and being fair with your previous employees and pay them a fair separation or something payment, so they're happy. You want to reward them for many years of service, but at the same time, you've got to bring your salaries down. You don't want it scaring away prospective buyers. So 2 years ahead of time, because the buyers are all looking for long-term staff. So 2 years ahead of time, maybe you'll do a replacement of that highly paid staff member and just, offer a cash settlement or some kind of payout. And I think that would work. I've seen situations where that work. Everybody's happy. Or that staff member becomes more of a part-time type of situation where their costs are a lot less. And now you have another younger employee that has as much, that has the experience, has been around the practice, that can carry the deal forward, that can carry the management of the office forward, but your expenses are less. That is sometimes a consideration. I think it's something you can consider, but you're going to have to do this 2 years in advance to get the proper people integrated in, so they become a 2-year employee, and that will keep the buyer happy. That will keep your overhead down lower, and it will probably work out well for you. So it's something to think about in the future and begin planning for it now. Thank you.